Hey, I just wanted to real quick go through where in my body dystonia affects me. We'll start at the bottom and go to the top. So it affects my toes. My toes will curl, flex, they'll hold an incorrect, uncomfortable, whatever position. That fluctuates day to day as most areas of my body do. My left toes, while still affected by dystonia, are also mostly paralyzed. Some of them are completely paralyzed because of being cut into once with a surgery very early on in my diagnosis. So that's my toes. Then we have my feet. They are, again, it depends on the day, but sometimes they're just locked in tension and in different ways. My right foot tends to lock in tension, and so it's difficult to move it anywhere, whereas my left foot tends to curl in despite 2 tendon lengthening surgeries in my calf. So my left calf is mostly paralyzed, or partially paralyzed, and yet there's still that movement of my left foot where it will curl inwards. And then we move up. My calves are still affected by dystonia, but to a lesser extent than my feet. And then my upper legs, this is where it gets a bit more nuanced because a bigger area, there's more, there are different ways where the dystonia can show up, or how the dystonia can show up. So, before DBS, neither of my legs could straighten out. They were always bent like this. I couldn't straighten them out because my hamstrings were so clenched. I still deal with tight hamstrings more on my right leg than my left. Thank God, most of the time that's not as affected by dystonia. Although my quads and my upper legs in general will get very clenchy, spasming, holding tension if I'm stressed or something. And I'm trying to think because I know that there was a time when they also pulled inwards towards each other. I always forget if it's the abductor or the adductor, which is inside or outside, but it's one of those, one that pulls them in. I feel like that's more on the left. So general tension that comes more with stress in the upper legs. And then we move up. I feel like it does affect my glutes a little bit, but I don't know, that's difficult to tell. And I feel like there is kind of a general held tension in my left abductor or adductor, whichever it is. But anyway, so moving upwards, and then we got the back. And the back is all sorts of different areas that get affected by dystonia. So we've got the lower back, which used to be one of the absolute worst areas of dystonia. And anyone who's ever experienced low back pain can understand why that would be so severe and difficult to deal with. But that comes and goes for me more these days, post DBS. I think it is always there, and a bit when we get working up the spine, my low back is kind of always there, but it's at a lower level, so I'm used to it and don't notice it as much. But the mid and upper back, the muscles that would pull me backwards or arch my back, those have always been pretty strong once the dystonia spread to that area by the time I was 12-ish. And so mid and upper back with the lower back all get very, both held tension and pulling, so spasming, particularly when I'm talking. Often I will need to lean forward or hold on to something so that I don't go flying backwards when I'm very animated. And then it gets, the higher up in my body you get, the more nuanced the affected areas become. So in my upper back, you've got my traps and all the muscles in the back of the rotator cuff, in the front, and the armpit area, and down my arms. All of this is affected by dystonia, and it's different on each side. Thus far, the left side has been much tighter than the right side. The right side is affected by dystonia. My hand will spasm, or it'll be difficult to use it in kind of a fine motor way, of, picking up something small, gripping. But in general, it's much easier than the left hand, which even now you can see it does not want to do. I'm trying to open and close it like this, and this is what it's doing. So the right hand is much better, much more relaxed and usable than the left. But my right forearm will clench when I'm using my right hand, and that's kind of activity activated dystonia, which so there are different types of dystonia, or the way dystonia shows up for me is different depending on the muscle group. So in some muscles, like my left hand, I would say at this point there's a lot less constant held tension, but I'd say in my legs there's more held tension, and then the higher up you get, it's more, it can be held tension like this. The muscles that are involved in making my left arm pull into the side, those tend to stay clenched. But for the most part, the muscles in my upper body are more activated the dystonia is activated when I use them. So if I'm sitting just relaxed, I might get some tension and some spasms. But once I start to do something, an activity, then the muscles clench, making it more difficult. And of course, with different muscles doing different types of things, that's a lot for my brain and my body to have to contend with at once, because I'm having to think about, okay, I'm trying to, we'll say, type on the computer. Well, my fingers, my right hand might be able to type, but my left hand isn't really working, so I have to work around that. But at the same time, my left arm is pulling in, my right forearm is clenching, and my back is kind of arching, and my legs are clenching because of all the activity that's going on. So it's a lot of different things in different areas in different ways of spasming to deal with. So so that's my upper arm, and kind of in general what's going on in my arms. There's so many individual little muscle groups around the shoulders in particular, that it would take way too long to go into each single one. But then you get into the neck area, and the pecs as well, but the pecs I'd count as part of the shoulder area. And so yeah, we'll talk about the neck. My neck is very dystonic. There's usually a constant sense of clenching. Again, it depends on the day, but it's all the way up here where it's into my jaw and my tongue and all the way down. And usually the clenching is just holding that tension. It typically doesn't move my head around, as some people with dystonia, that can happen to them, but it just clenches that tension, if that makes sense. And moving upwards, combining that with the dystonia, again, in my tongue, both the back of the tongue, that you can feel back here, in the middle of the tongue, which tends to push up against the roof of my mouth, and my jaw, and the muscles around my lips are all wonky. They're all, when I try to talk, depends how tired I am, how stressed I am, but most of the time, all of this is affected to a certain extent by dystonia. And right now, I'm usually comprehensible when I speak, because I have done some speech therapy. I've also done acting for most of my life, so I know I'm just kind of trained to enunciate, but it takes so much work and concentration to get everything working, and it hurts after a certain amount of time, because there's a lot of this going on, and again, pulling in different directions and having to focus on different things. It's difficult to pronounce consonants that involve the tongue and the lips, because my tongue and lips are affected by dystonia. And then it can be difficult to be heard, because with all this going on, I can't just relax and talk, because if I just do that, now's not a good example because I'm still trying to focus on being comprehensible, but if I'm just relaxing and talking and I'm just trying to be heard, then stuff gets kind of caught in my throat. There's a lot getting just stuck here because of all that it has to contend with before coming out of my mouth. So I have to take big breaths and push it through and think about how I'm moving everything. It's so much to think about just to be able to speak and be understood. And like I said, it is very painful after a while. My cheeks get so exhausted after, I'd say, on a bad day, they'll start hurting instantly. It always hurts in here to talk. My jaw, it all gets very exhausted and very painful very quickly. And then, where else is affected? My eyelids are affected a bit, and that's a bit more inconsistent though. But they'll tend to push down. Sometimes when I've been on particular pain medications, it's somehow triggered that. And then if I'm trying to put in contacts, I know that there are definitely people who get blinky eyes, but my eyes will just clamp very hard. And I have been told by ignorant folk that from time to time that my symptoms aren't that bad, or that that they're not noticing it. And I don't know if they're just trying to make me feel better because it's like better to not appear as disabled as you are or whatever. But I know the difference because I used to be normal. Well, physically normal. I have experienced, now it's been a long time, so it is very hard for me to remember what it feels like to move around and particularly walking and moving around and running without, sorry. I didn't think I'd get emotional, this is ridiculous, but hey, my period's coming up, that's probably why. And I'm a Cancer, so I'm always emotional. But the dystonia symptoms were very obvious by the time I was 9. And they were subtle before that for a little while. It's hard to put a finger on exactly when they started, but by the time I was, between 9 and 10 or 11, I went from being a relatively normal kid physically to completely severely disabled. So I have seen the progression from being able to move a certain way without muscle spasms, being able to talk without dealing with all this shit that's going on in my mouth and my throat and my neck and my jaw. It was, by the way, it was a dental hygienist told me, I had warned them. This was when the stuff with my tongue and that general area was getting more pronounced. I warned her of that so that she could be aware. And she said, no, you're fine. Well, that's because again, dystonia symptoms shift for me depending on the time of day, the stress of the day, whether someone else can see it or not depends on how much control I can have over that area in my body. So when I'm very concentrated on holding everything still or relaxing as much as possible, it just pissed me off because I know what my body is like, and I know how it has changed. So anytime that somebody says, oh no, your symptoms aren't that big or that big a deal, it's like, you are not really the most intelligent person, are you, to be saying something like that? So anyway, I don't take it as a compliment. So now that I've listed all the areas of where dystonia affects me, for the most part, I think, you have a picture now of how it just takes a lot of physical energy, mental energy to deal with all of this. Ugh. And yeah, because I'm so worked up, my tongue's spasming and all that shit. But I was gonna say something right before then. Yeah, I don't take it as a compliment when somebody says, you don't look disabled, or when you're sitting down, I can't even tell. I had a therapist, to be more specific, a psychologist, like a counselor, tell me that. And they always were talking about how they know, they're so experienced with people who have disabilities. And here they're telling me this like it's a good thing that they can't tell that I'm disabled. Like that makes me more valid because I can pass for able-bodied when I'm sitting down or some shit. And it's like right now you can't see because it's out of frame, but I've got my left arm hooked into under my knee, so that, has been a trick, by the way, if you've gotten this far and you have dystonia, a trick can be if you've got a hand or a foot in particular that gives you a lot of trouble, is very spasming and stuff, sitting on it, honest to God, sitting on it can help. It's helped me. Maybe it can help you. I don't know. I've done that with my right foot. I used to do that all the time. That's how I moved about in my wheelchair, is I would have my right foot under my left butt, and that's the only way I'd find relief from the clenching all day. And so as I'm sitting here, rather than having my hand in my lap where my arm is going to be going like this all the time as I'm so animated, and my hand will be like that, I just kind of smush it in under my knee, and the sort of clenching of the hand helps relieve the symptoms. So that's a random tip. Anyway, for what it's worth. But yeah, that's just such a big problem, because already navigating the world as a disabled person is beyond frustrating. You know, to just try and have a life where you can enjoy things, and now, you know, that it's summer, and just being able to go out and be in nature, be in the sun. When you have a disability, it's very difficult. When you have a physical disability, just getting around to do things that other people take for granted is sometimes just doesn't even happen. So it doesn't help when people think it's a compliment to tell somebody that they don't look disabled. It's like, well, because the people who've told me that are the same people who would refuse to park in a handicapped spot, or, you know, provide accommodations for my disability needs. And so saying I don't see your disability is saying I don't see where I should be helping to accommodate your needs, or I don't see your disability, therefore I'm not going to help accommodate your needs. So that's my little sermon at the end of this. You know, I know it can be awkward sometimes for people to, I guess, just interact with somebody who has a disability, but if you're saying that you don't see the disability, then you're not seeing that entire person and what they need and what their experience is, what their life is. You're not seeing them. So I went from a rundown of all my dystonia symptoms, and I guess maybe the reason I got to that place is just because, you know, now that I've described how much of my body is affected by dystonia, and how much of my day is affected by dystonia, whether it's typing, speaking, picking anything up, eating, because all this stuff with my neck and my jaw and tongue makes it difficult to swallow. So it's literally my entire day. I can't, unless I'm just lying down watching TV, which is a good option. But if if I'm actually doing anything, from something as simple as drinking a glass of water, or whatever, you know, something that simple and beyond, is going to be affected by dystonia. So, and obviously I'm not the only person with dystonia, I'm not the only person with a physical disability, so just a heads up, you know, you don't have to ask for or know somebody's entire story of disability to still acknowledge them as a complete human being who may have needs for accommodation and accessibility. And the only way to offer that to them is either to listen if they're asking for that accessibility option, or to ask them if there's anything that you can do to make the environment more accessible for them. So now that my tongue is officially worn out, I'm gonna say goodbye. So yeah, thank you for listening to me talk about my body and the way dystonia affects it, and hopefully that was helpful to somebody out there. And yeah, as I tend to say at the end of most of my videos, I'm really bad at just shutting up and saying goodbye. So I hope you're all having a great day, and thank you again for listening in.